In this video, we will discuss the pharmacological management of essential tremor, ET, a neurological disorder characterized by involuntary shaking. We will explore different drugs used to treat ET, their effectiveness, safety, and potential off-label uses. We will also look into emerging therapies and the importance of patient monitoring and counseling for optimal treatment. Treatment options for essential tremor include beta blockers and antiepileptic drugs. Beta blockers, such as propranolol and primidone, are considered first-line therapy and can significantly reduce tremor severity. Antiepileptic drugs, such as gabapentin and topiramate, may be used as alternative or adjunctive therapy when beta blockers are ineffective or not tolerated. To summarize, beta blockers like propranolol are commonly used to treat essential tremor. They work by blocking certain receptors in the nervous system, which reduces tremor severity. Propranolol has been proven effective in clinical trials and starting dose is usually 40 mg twice daily, with side effects like fatigue and bradycardia. Antiepileptic drugs, AEDs, like primidone and topiramate have proven effective in managing essential tremor. Primidone enhances GABA neurotransmission, reducing tremor severity. Common side effects include sedation and dizziness. Topiramate's exact mechanism of action is not fully understood, but it may involve modulating GABA and glutamate. It has side effects such as cognitive impairment and weight loss. In summary, comparative studies have shown that beta blockers and AEDs are effective in treating essential tremor. Propranolol and primidone are commonly used as first-line therapies, while topiramate can be used as an alternative. Treatment response varies, and individual characteristics should guide medication choice. Propranolol, a non-selective beta blocker, remains the cornerstone of pharmacological therapy for essential tremor. Its efficacy in reducing tremor severity has been consistently demonstrated in numerous clinical trials and observational studies. The mechanism of action involves competitive antagonism of beta-adrenergic receptors, leading to reduced sympathetic outflow and tremor attenuation. The recommended starting dose is typically 40 mg twice daily, with titration as necessary to achieve optimal symptom control. Adverse effects are predominantly mild and include fatigue, bradycardia, and hypotension. Primidone, an antiepileptic drug, has shown significant anti-tremor effects in essential tremor management. Although its exact mechanism of action is not fully understood, it is believed to enhance GABAergic neurotransmission and reduce neuronal excitability. The recommended initial dose of primidone is 12.5 to 25 mg once daily, with gradual titration to achieve the desired effect. Adverse effects commonly reported include sedation, dizziness, and cognitive impairment. It is important to monitor serum levels and adjust dosing accordingly. Topiramate, a broad-spectrum antiepileptic drug, has emerged as a potential treatment option for essential tremor. While its exact mechanism of action in tremor control is not fully understood, it likely involves modulation of GABAergic and glutamatergic neurotransmission. The recommended initial dose of topiramate is typically 25 mg once daily, with gradual titration to achieve optimal control. Adverse effects include cognitive impairment, weight loss, and paresthesias. Individual patient characteristics should be considered when selecting and dosing topiramate. In addition to their approved indication for essential tremor, beta blockers have also been found to benefit other movement disorders. Off-label use of beta blockers, such as nadolol and atenolol, has been reported in the management of certain tremor syndromes, such as orthostatic tremor and dystonic tremor. While the evidence for their efficacy in these conditions is limited, beta blockers could be considered as an adjunctive treatment option when other interventions have failed. Adverse effects and individual patient factors should be carefully considered when using beta blockers off-label. Antiepileptic drugs, primarily intended for managing epilepsy, have also shown promise in the management of essential tremor. Beyond primidone and topiramate, other AEDs, including gabapentin and levetiracetam, have been explored in the treatment of refractory essential tremor. The off-label use of these AEDs should be considered cautiously, given the limited evidence and potential risks associated with long-term use. Careful monitoring of treatment response and adverse effects is crucial in such cases. Combination therapy with beta blockers and antiepileptic drugs has been explored in individuals with refractory essential tremor who do not achieve adequate symptom control with monotherapy. This approach aims to target tremor through multiple mechanisms of action and potentially enhance treatment efficacy. The choice of specific agents, dosing, and titration should be individualized based on the patient's clinical presentation, treatment response, and tolerability. Close monitoring and follow-up are essential when implementing combination therapy to optimize outcomes and minimize adverse effects. While beta blockers and antiepileptic drugs represent the mainstay of pharmacological management for essential tremor, emerging therapies are being investigated to expand treatment options. Deep brain stimulation, DBS, magnetic resonance guided focused ultrasound, MRGFIS, and other neuromodulatory techniques hold promise in providing long-term control over tremor symptoms. These approaches involve targeted modulation of brain circuits implicated in essential tremor, offering potentially more precise and sustained tremor reduction. Although still undergoing research and development, emerging therapies may revolutionize the management of essential tremor in the future. Optimal management of essential tremor goes beyond selecting and initiating pharmacological therapy. Patient monitoring and counseling play a crucial role in assessing treatment response, optimizing dosages, managing adverse effects, and addressing patient concerns. Regular follow-up visits are essential to gauge treatment efficacy, titrate medications, and provide appropriate education and support. Additionally, counseling regarding lifestyle modifications, stress management techniques, and the impact of essential tremor on daily activities can significantly improve patients' overall well-being. In conclusion, pharmacotherapy is crucial for managing essential tremor, aiming to decrease tremor severity and improve patients' quality of life. Beta blockers like propranolol and antiepileptic drugs such as primidone and topiramate are commonly used as first-line treatments. Comparative studies guide treatment choices, and individualized therapy is crucial for optimal outcomes. Off-label use, combination therapy, and emerging treatments offer additional options. Patient monitoring and counseling are vital for tailored treatment plans and adequate support. Ongoing research and technological advancements promise promising interventions for this neurological disorder.